Hello everyone, welcome back to our studies of the occipital bone, and we have already gone through the squamous part of the occipital bone. So now we are left with the basilar parts and the condylar parts. Now the basilar part has got an upper surface and it has got a lower surface, and here you can see the inferior surface of the basilar part of the occipital bone. Just in front of the foramen magnum, the basilar part of the occipital bone on its lower surface has got a midline elevation. This is called the pharyngeal tubercle. This pharyngeal tubercle gives attachment to the midline raphe of the constrictor muscles of the pharynx, that is the superior constrictor, middle constrictor and inferior constrictor. All the three muscles have a common attachment over here to the pharyngeal tubercle. So that means somewhere here is the outline of the pharynx, the muscular pharynx. So if this is the pharyngeal tubercle, you must be having the covering fascia of the pharyngeal muscles also attached to the basilar part from below. So in front of the pharyngeal muscles, you can make out the inner fascia, the pharyngobasilar fascia, and outside, covering the pharyngeal muscles from outside, you have the covering buccopharyngeal fascia. Not only that, behind the muscles of the pharynx and their fascia, you have the prevertebral fascia. This is another layer of the deep cervical fascia. If you recall, the deep cervical fascia has got an investing layer, it has got a pretracheal layer, and it has got a prevertebral layer. So the prevertebral layer is attached here, and by the sides of the pharyngeal tubercle you have a shallow depression. This depression is for the attachment of the longus capitis, and still laterally this is the attachment of the rectus capitis anterior. If you move from the basilar part onto the condylar part, here you can see these are the occipital condyles, which will contain facets articulating with the superior set of facets of the atlas. And so these are forming synovial joints with the movements. These are responsible for actually yes movements. You know that the atlantoaxial joint is responsible for the yes movement, and the atlantoaxial joint is responsible for the no movement, and the atlanto-occipital joint is responsible for the yes movement. And here again we come to the margin of the foramen magnum, and at the margin of the foramen magnum you can make out these two alar ligaments. These are coming from the sides of the odontoid process of the axis, that is the dens of the axis, and they are going to the small elevations on the inner aspects of the condyles of the occipital bones. So these are the alar ligaments, and again you have the anterior atlanto-occipital membrane and the posterior atlanto-occipital membrane. Not only that, behind the condyles you can make out the condylar fossa, which actually lodges the superior articular facet of the atlas in full extension, and it may contain a condylar canal containing an emissary vein. And we are now on the condylar process, on the condylar part of the occipital bone, and on the condylar part of the occipital bone, apart from the condyles bearing the facets, you have the condylar fossa, and passing through the condylar part actually from medial to lateral you have the hypoglossal canal. So this is the hypoglossal canal. It has an inner opening somewhere here, and it has an outer opening. So this is the opening of the hypoglossal canal. It perforates the condylar part of the occipital bone through and through, and this prominence over here is the jugular process, and this groove in front of the jugular process is the jugular notch. So let us see this same thing from the superior surface. Here you are. Again you can make out the basilar part of the occipital bone and the condylar parts of the occipital bone, and on the basilar part of the occipital bone you can see a number of structures. In the middle it is related to the two vertebral arteries joining to form the basilar artery, and lying above this will be the pons and the medulla oblongata, and you can make out from the vertebral arteries the anterior spinal artery, and from the posterior inferior cerebellar arteries the posterior spinal artery. So these will also be related to the basilar part of the occipital bone. This slope of the basilar part of the occipital bone is actually joined to the slope of the posterior surface of the body of the sphenoid. This is the anterior surface of the basilar part. This anterior surface articulates with the posterior surface of the body of the sphenoid. forming a slope, a ramp, that is called the clevus, and the pons and medulla are actually lying on that ramp between the over the basis sphenoid and the basi occiput. And over the entire clevus you have this network of veins, which is the basilar venous plexus. So you have the basilar artery, vertebral arteries, anterior spinal artery, posterior spinal artery, basilar plexus of veins, and the pons and medulla with their covering meninges. And on the sides of the condylar parts over here, they articulate with the posterior border of the petrous part of the occipital bone, and where they articulate with the petrous part of the occipital bone, this groove bears a sinus, the inferior petrosal sinus, and this inferior petrosal sinus is actually draining into the jugular foramen. So this jugular process and this jugular notch, over here you have the jugular process and the jugular notch, you have the jugular process and the jugular notch, and when you have the petrous part of the occipital bone articulating here by its posterior border, this jugular notch will be converted into a jugular foramen. So from here to here you have a jugular foramen, and from here to here you have a jugular foramen. So what are the structures passing through the jugular foramen? One is this one, the inferior petrosal sinus. Then you can make out these three nerves, the glossopharyngeal, vagus and accessory nerves. These are dropping down through the jugular foramen, and over the jugular process there is this curved groove. Over here you can make out the curved groove, which is colored here, and this contains the sigmoid sinus. So this is a continuation of the transverse sinus from the mastoid part of the temporal bone, and this sigmoid sinus goes down through the jugular foramen to form the superior bulb of the internal jugular vein. So through the jugular foramen you have inferior petrosal sinus, 9th, 10th, 11th cranial nerves, sigmoid sinus, and emissary veins connecting the sigmoid sinus with the basilar venous plexus over here, and again veins connecting inferior petrosal sinus with the basilar venous plexus, suboccipital venous plexus rather. And on the condylar parts here you can make out an elevation that is actually the jugular tubercle. Here you have an elevation that is the jugular tubercle, and these 9th, 10th and 11th cranial nerves are just behind this jugular tubercle. Somewhere here is the jugular tubercle, and 9th, 10th, 11th cranial nerves are on the flat area behind the jugular tubercle. So now you have more or less seen the basilar and the condylar parts. We will just go into a brief discussion of the foramen magnum itself. So here you have a picture of the foramen magnum, and it has an anterior part and a posterior part. In the anterior part you can make out the odontoid process and the alar ligaments, and the structures which are passing, there are some structures which are passing between this anterior margin and the odontoid process and actually dropping down onto the basilar part of the occipital bone over here. One of them is the apical ligament, and then you have from here the superior crus of the cruciate ligament, and behind them the membrana tectoria, the apical ligament from the tip of the odontoid process, and the superior crus of the cruciate ligament as a continuation of the transverse ligament of the atlas, and the membrana tectoria, which is a continuation of the posterior longitudinal ligament. In the posterior segment you have the medulla oblongata, which is covering pia, arachnoid and dura mater. From the pia mater you have these projections, the ligamentum denticulatum. These are tooth-like, and the first set of teeth are attached to the margins of the foramen magnum. Apart from that you have the passage of the vertebral arteries, anterior and posterior spinal arteries, one anterior spinal artery, two posterior spinal arteries. You have the spinal part of the accessory nerve coming up through the foramen magnum, and you have the tonsils of the cerebellum over here slightly dipping down into the foramen magnum. So the structures that are coming up through the foramen magnum are the vertebral arteries and the spinal accessory nerve, and the structures that are going down are the medulla oblongata and the spinal arteries. Thank you. That will be all for now.